Okay.
There we
So
go.
years in the Baker College Occupational Therapy Program, and right now we are taking the Complementary Therapies and Wellness and Occupations course, and so that's why we were assigned to interview you.
Great. How's the course going so far?
Good.
Good. It's different
Yeah.
than anything we've taken so far.
Yeah, I would hope so.
Yeah.
Complementary and alternative therapies should be very different than your traditional OT curriculum. And does everyone have to take this? I'm curious, or is it an elective?
Mhm.
Tell me about that.
So everyone does have to take this at Baker College.
Wonderful. That's great.
And then it's kind of nice too because we only have 7 students in our class, so it's been pretty hands-on, but we did just get moved to an online format.
Oh, were you doing in person and you just got put to an
Yes,
online
we just
format?
moved to an online format.
Wow. Wow. It's a challenging time to be a student and a clinician right now,
Yes.
to say the least.
Mhm.
Then I can get us started with our first set of interview questions. So does insurance typically cover your services, or is it typically covered with private pay?
It's typically private pay. So I've been owning a clinic setting, involved in owning a clinic setting since 2001. And I initially started out without any sort of opportunity for insurance possibilities. And then at one point in our time, we became a non-participating Medicare provider. And what that meant was that the client would pay up front. I had a biller on staff that would bill for them, and they would get a reimbursement check from Medicare. So, but it was only partial payment. So typically, and I interface with a lot of alternative holistic practitioners around the country because I have the pleasure of educating and mentoring a lot of them across the country. Typically, insurance does not cover our services, and I've kind of seen that over the span of almost 20 years now.
Okay. So then what is the typical demographic of clients you see?
Well, that is definitely subject to change depending on the year and the time, just in the time in general. I serve a lot of people who have chronic, unabating health situations, such as Lyme disease. I see a lot of Lyme. I see a lot of fibromyalgia, chronic fatigue. I also see a fair bit of neurological, such as Parkinson's, MS. And I also serve pre and postnatal and pelvic floor. That's one of my specialties, which in my mind shouldn't be alternative or holistic. I feel every woman who chooses to have a child should have prenatal rehab work as well as postnatal. And sadly, they don't find it until they have an issue. So it's often falling under the complementary therapies. And it's partly because of the modalities that I use that it falls underneath that. So I'm trying to think of other populations. I also work with children. So I work with children, usually none younger than 8, but about 10 and up. And so for them, it can be more of enhancement for school function, dance, what have you. So they're coming in for the complementary services, ADD, ADHD.
Oh, so a pretty large range. That's very interesting. So you do see, my next question was, what conditions do you see? So there are quite a few different conditions you see. You kind of answered that with my prior question. But then what are some different settings do you think would benefit from this practice?
What are some different settings that would benefit from this practice?
Yes, like hospital settings, schools.
Well, I certainly think that a hospital setting could benefit. You're saying from complementary or holistic services?
Yes.
Yes. I definitely think a hospital setting could benefit because sadly there's a lot of dehumanization that goes on in a hospital setting, whether it's starting in the ER or a woman going in for surgery, for breast surgery. It's very dehumanized, and the mental health component is often lost. And I think we as OTs are beautifully aligned to service the mental health component. And that's where I really think, and I would say to students that you need to sort of embrace those roots and be willing to dive a little deeper into the mental health component because our world needs it now more than ever. I've always served people with anxiety, for example, but I cannot tell you the number of people that are being sent to me right now for anxiety and mental health conditions as their primary challenge or diagnosis. So I think that we want to run with that as OT. So a little side note there. I think other settings, definitely schools. I think there are a lot of OTs that are serving so beautifully in schools. I have a lot of friends that are OTs in school, and they are, they may not be hanging out a shingle to say they're complimentary, but they're studying whether it's brain gym or other tools that are more holistic and complementary. They're bringing that there. They just may not be labeled as such. So I definitely think schools, I think community centers really could benefit from OTs and OTs bringing in the complementary services. I think the military is an area of great need as well because we see so much PTSD, we see so much mental health challenge, we see so much physical injury, which has emotional. If someone has a physical injury that takes them out of their military line of duty, that can be crushing blow to their life. And that may be someone who's a career military. So I just think there's so many amazing areas that need OTs that are trained in complementary. But again, I think OTs are holistic to begin with when you really look at the root of our training. But I'll try not to get too far off track because I could go on and on.
So then what are some recommendations for students like ourselves of things we could implement into our everyday lives to help improve our wellness?
Ooh. Will you say that again? I want to make sure I got all parts of that because that sounds like a juicy one.
What are some of your recommendations for students like ourselves that we could implement into our everyday lives to help improve our wellness?
Well, first and foremost, taking the time is really hard when you're an OT student. I can remember that very well. And you're so focused on studying and perhaps clinicals and just trying to get through. So I think very simple, basic things like hydration and rest and being willing to drop in and look at the emotions that come up. I was just reflecting on this the other day because I remember doing clinicals and having a lot of emotions coming through my system because I served in a pediatric hospital for one of my level 2 field works and seeing children with life-altering situations, and then working at a neurological setting for my other level 2, seeing people again whose lives were disrupted, young women having strokes during pregnancy. That's a lot to process as a student. So one of the first things I'd say is get some ways to allow yourself to emote, look at the emotions that come up. I mean, we certainly have to keep our professionalism and make sure that when we're in the clinic setting that we're allowing those emotions to be self-regulated so that we can be of service and not let the emotions take over. But we have to acknowledge those emotions and process them, have space to hold, have someone hold space for you, and have resources. And I'm a big believer in 5 to 10 minute moving meditations. And if any of you as students need them, go to my website, inspiredwell.com, because I have a 10-minute meditation that's actually done in the car. It's for healthcare providers. So before you go into your level 2, you sit in the car and you go through this nervous system integration. That's a meditation. Or after, like you've left and you're thinking of the client you saw that day who've been through trauma, who've just received a prognosis that's life altering, and you're trying to process that as well as then transition from the role of caregiver to or healthcare provider to your home life. And so I think, again, it's a topic I love to talk about, but you really need to fortify your nervous system to be able to recognize and acknowledge the emotions and then process and move through the emotions. Otherwise, you won't last in the field because there's a lot of scary stuff that you see, a lot of really intense work. And I think a lot of us that get into this field, we are empathic, we are empaths. And so we have to learn how to process all of that and keep our compassion high, but keep our boundaries clear. Does that answer your question?
Yes, it does. That's actually very helpful too. I think we all get very stressed in this program, so those are definitely
Oh, yes.
some good
I
advice.
remember that. Yeah. And those are sort of unique ways of looking at it and really addressing the emotion, but going for a walk, being in nature, those are tools that I think are really, really important. I think people have a nature deficit, and most every one of my home programs has some component of nature involved in it, no matter what the capabilities of the person who is being given the home program.
And then my next question is, what form of documentation do you use?
I think about this often because I'm kind of archaic in my documentation. And I think about this a lot because I am somewhat tech savvy for an OT that's been practicing for 20 years. I have virtual offerings. I use social media as a platform to share free content to people that may not be able to access my services. But my documentation is not at all digital. My documentation is still paper and pen. And I thought long and hard, it would probably be really slick and nicer in terms of format to have my documentation on a tablet. However, when you put that tablet between you and the patient, you disconnect. I don't feel that I can hold space for that client or patient with a tablet, with a device in front of me, because it's almost like taking out my phone in this interview and going like this when I have set aside this time to focus on you. And if I put that device between us, it really disrupts their connection. My therapeutic use of self is not able to be fully present or fully given. So I still use pen and paper and a clipboard, and I'll have the person in front of me and I'm documenting. I still use a SOAP note format, and I'm definitely asking the client for changes. I'm very mindful of how I ask for that because I want them to be empowered and not to always feel that I'm asking for something to be negative, but that's probably for another day. And then I have a lot of check boxes. So I do make it very quick, but I like to keep documentation as to what we're doing. And it's definitely more archaic. So it's not going to have some beautiful printout. It's not going to be ready for research. So I know I could do better in that area perhaps, but I'm just not willing to put a device between me and the patient at this point. There might be something I could do down the road, and I'm sure as students, you've probably got great suggestions. You're more on top of that.
And then I believe Ashley has the next set of questions.
Okay.
Yep. Okay, my question for you is, what led you to creating Inspired Wellness?
Well, this is a question I love because I was in my final year of OT school, and we were given a project by one of our professors to come up with a community-based wellness program. So my undergrad was in exercise science, exercise and health science, exercise physiology. And so I always had movement and fitness as a secondary part of what I was bringing to the OT world. And I knew that I wanted to create this multidisciplinary setting. And so my project was to create this setting, and it was called functional fitness. Well, I went into the field of OT. I only lasted 3 years in the traditional setting because managed care was starting to really take hold, and I was feeling the factory. I was, after 20 to 30 minutes being forced to pass a patient or client to a tech, not a coda, but a tech. So that's not the kind of treatment I would want for my family member, and my license was on the line. So after 3 years of that, and realizing that the reductionistic model was only going to be coming further on, I decided I joked that I was brave enough or stupid enough to step out and open my own clinic setting. It was called functional fitness at the beginning, but after a couple of years, I realized fitness was limiting because I wanted all bodies and minds and heart spaces, no matter what the ability, to access this. So then the name changed to Inspired Wellness, because what I found was that my mission really was to inspire people towards wellness, to really empower them. But I have been probably more inspired than the people I serve are by me. I mean, I'm continually in awe of these people that I serve. It blows me away every day.
Okay, and then the next question is, what have you learned from it? Do you have any major takeaways?
From starting the business
Yeah.
or, okay, oh, wow. How much time you got? um, I have learned so much. I mean, I kind of categorize it into the business learning, into the humanistic learning. And I've started writing different pieces about 20 things that I've learned to be so important in 20 years as an OT. I've learned that people will continually amaze you. I've learned that the human spirit is more resilient than we ever could imagine. I've learned that people you have to meet people where they're at. You know, you have to, I think I'm a pretty good OT. I mean, I get feedback a lot that I'm a very good OT or a great OT, and I think I'm pretty good. But what I think makes me a good OT is that I can really quickly assess where that person's at and meet them where they're at. And I don't just mean if the person's a little down that day, making sure my energy's not too up, but only giving them bites of what they're ready for in terms of complementary alternative services. Because you'd be amazed at, you think most of my clients would be a little bit more on the woo-woo side because they're coming to a holistic OT. But I see a lot of attorneys. I think it's because they're really stressed out and they don't have anywhere to put that stress. And so it manifests on a physical level. So I think what I've learned is that people really do want to believe in the power of their own body to heal itself. They just need some guidance. And I think I'm continually in awe of the human body's ability to heal itself when given the right guidance. So I'm just going to pause there because I could say a lot more, but I also know that you're busy students and I don't want to bore you to tears.
Okay, the next question I have for you is, how has COVID-19 impacted Inspired Wellness?
Great question. I was hoping we'd go here tonight because I think it's really important. So March 13th was my last day of business as I knew it. And March 16th, I was ready to serve people virtually. Now, I was granted I was set up to do some virtual work before then. I had offered virtual webinars and seminars, and I do a lot of sessions for people all over the country that want to tap into a unique offering, a unique treatment, but they don't live close enough. So I was set up to do virtual work. However, I was grateful that I could pivot so quickly. And this may not be a big deal to all of you, but I have a little bit of virtual anxiety, or not virtual, I have a little bit of technology anxiety. And I've learned a lot in the past 3 years. I have a coach who helps me with that because I really believe that I can learn more and better serve people if I'm at ease with using technology. So I was really grateful and pleased. So that Monday after, I was seeing whoever wanted virtual sessions, but of course, not everyone. I do a lot of manual therapies. I do cranial sacral, I do lymphatic drainage, I do brain gym that has some manual, reflex integration that has manual components. So some people just couldn't be served by that. And then, as I said, I am seeing a ton of anxiety. I had clients that I had served in the past who had struggled with anxiety as a secondary diagnosis. It became their primary diagnosis. I started to get new referrals for anxiety. And then certainly in July, I started to welcome people back in person very selectively with major protocols. I had to invest thousands of dollars in equipment for my clinic so that I can safely welcome people back in. And just a side note here. So the clinic that I first established in Birmingham had multidisciplinary, we had PT, we had Feldenkrais practitioners, infrared sauna. That 12 team member setting, I shifted 5 years ago. I downsized or right-sized because I finally became a mom. My husband took a job where he was traveling a lot. And I also had to look at the 3 areas I was responsible for: providing treatment, managing the team, educating other professionals. The two parts I love right there are educating other professionals, supporting other professionals, and providing treatment. The management piece, while I had enjoyed it for a while, it was becoming very stressful. So I let that go. And then I downsized or right sized, and I went down to a one person clinic setting. We built this clinic studio attached to my home that's separate. And I thought a portion of my clients and patients would come, but they all came and then they brought their family members. So I feel very fortunate because I'm not in a big clinic setting where we have a lot more concern and fear. So I have one person coming at a time. We have major protocols. If a client has flown anywhere, they can't come back in for 2 weeks after. We have a transparency policy that I'm upholding, the clients are upholding. So on that housekeeping logistical side, it's changed things, but it's changed in the sense that every session has been taken back to the 55-minute session instead of the 60-minute session. So we have a little extra time for cleaning. I allow time in between. My self-care as a practitioner has to really be upped because I'm wearing a mask all day and I'm doing all this extra efforting, and the patients and clients are coming in with an intense higher level of anxiety. So I have to take care of myself on a different level so I can be clear and ready to be of the highest level of service. So my self-care has had to be upped. My logistical environmental setting has to be totally different. And the needs of those I serve has become totally different. Now, on the plus side, it's allowed me to really roll with some of my virtual offerings, like Inner Resources, Inner Nourishment. People are hungry for those because they want to be empowered for their own self-care, and they're able to do it. And more people are becoming comfortable with the virtual model. Like some of my clients that hadn't had a lot of experience, and I don't want to say it's only the older demographic, but a lot of times it is your 65 plus demographic, maybe didn't have a lot of Zoom experience. They've become very proficient and they're like, hey, I want to do your Tuesday work-in class now too. Can I join that? And I'm like, absolutely. So it's changed on so many levels. But every day I sit in gratitude that I can do what I love, because honestly, yeah, there's a financial component. This is my livelihood, but this is my path and purpose. This is my fulfillment. And I'd be going a little bit bonkers right now if I couldn't do it. So there's a lot to unpack there, and I can speak more to that, but that probably answered your question.
And then can you like explain what a typical class looks like for you, or a treatment?
Ooh, yeah. Well, it depends on which one, because they're all so different every day. Let's take this woman that I served today with ataxia, sort of a nondescript ataxia. She's 73 years young. I've worked with this woman for a lot of years. This is what happens when you have people private pay. You're like, you can be discharged. Oh, I just want to keep coming. Okay. Well, you can work with a colleague of mine, or you can do this home program and come back when you need to. I just want to keep coming. So I've had the honor of working with this woman for many years, and she came in and right away we're doing the gait reflex work. So reflex integration. She told me that she's having a rough day because she didn't sleep well, which affects her ataxia greatly. She's a retired special education teacher, so she's a really bright woman. She's super motivated. She does her home program and then some. Like, she's amazing at doing home program. And so we started out on the table. I did some hands-on integration of reflexes. Then I got her on the balance board. We timed her. Now today, it could have been a disappointing start because she was only able to hold for 9 seconds instead of the 1 minute and 22 seconds she did last week. However, I pointed out to her that she was getting extra credit today because that 9 seconds was without sleep. She's getting infusions, a Myers cocktail, which is a very holistic treatment, but whenever she gets it, it helps her to have greater balance and greater organization of her nervous system, and she was overdue for that. So I talked to her about, look, you're showing strong today with 9-second hold because you have all these things against you. So don't compare it to last week's minute and 22 seconds. Then I put her on the Pilates reformer, and we moved through alignment and reflex integration. We moved through endurance for her ankles and her ankle, foot, whole lower extremity complex. We worked on core alignment and breath. We worked on rib cage excursion because she has some costochondritis going on. Then I put her on the Pilates apparatus called a Cadillac. And we worked on neurological motor planning. She had a hard time sequencing, so it was active assisted and some active range of motion for that. So we did that. And then I put her on the table and we did more reflex integration. And I did some compression syndromes for ribs. I did some diaphragm releases. And then we finished with the balance board again. And by the end, she was up to a minute on the balance board. And we talked about safety, and she lost her cane again. And so I'm saying you need to find your cane. So there was just a gentle nudging about safety. So that's an example of a treatment. Do you want a different one or what? I mean, that's one very specific treatment, but what would help you to understand more,
We
or how
were
can
just curious exactly like what you do and what a typical
Yeah.
day look like.
Yeah, so that's one treatment today. I'm going to have a prenatal. I serve a lot of pre and postnatal women. So I have a a postnatal woman coming in who has a diastasis recti. Do you all know what a diastasis recti is? It's okay if you don't. So it's a split in the linea alba where pressures have built up. It often happens during pregnancy, but it can happen during labor and delivery. And that is causing a decrease in function. It's causing pain in her spine. It's causing pelvic floor issues, continence issues. It's causing issues with daily function. Her ADLs are greatly affected, like picking up her baby. So for her, I will be doing this week some manual therapy, myofascial work, as well as some movement-based therapies on the Pilates apparatus. I'll be doing reflex integration, brain gym, and I'll also be doing lymphatic work and probably some kinesio taping for her because she's got some lymphatic issues since delivering. And so I'll do lymphatic-based kinesio tape. I do a lot of kinesio tape work. And then this gentleman I'm going to see tomorrow, just one more example. He is someone I've worked with for years. He has high level of anxiety. He calls it COVID anxiety. He can't sleep. He's been on a medication to help him sleep, but he's now being weaned from it and he's having a lot of issues with it. So he'll come in. We're going to do a brain gym balance. We're going to do some neural tissue tension technique, manual therapy, because he's got some nerve impingement. And then we're also going to move posturally for him. We're going to work on some postural reeducation because he's a very tall, long-limbed man and he's a big golfer, and golf is his only mental relief right now. So if we can keep him playing golf by making sure he's also got a rib situation going on. So I'll probably do some cupping on his diaphragms and his ribs tomorrow, his intercostals, and then the brain gym work, as well as some compression syndrome work, and then postural reeducation. So those are a few examples of sessions, but here's the cool thing. Every single treatment is so different, and every day I'll have a plan for a treatment and boom, they come in with something going on and I've got to pivot and change the treatment. And I love that, being on my toes. Like, it's never the same. I could never have rote treatment over and over.
Can you explain what the work-in series is from your website that we've seen?
Sure. So the work-in series so I have had people through the years ask for group classes. At my other setting, we had group classes with the apparatus or just the mat and a small bit of props, like a small ball or a roller, for example, or a big ball. And for a while there, I was no longer teaching group classes because I just got pretty overwhelmed with the wait list for one-on-one sessions. And then when COVID hit, I thought, okay, people have been wanting me to teach a group class. My space is very intimate and small, so I can't teach group classes, and even pre-COVID. So, hey, pardon me, why not do it virtually? So this class is actually a beautiful synergy of mind-body integration, and it brings some of my work that I call inner resources, which is true mind-body integration, not just breathing or just thinking about it. It's going through those reflexes that get tripped up with movement to reintegrate. So we always start with that. Then we use a small myofascial ball to help awaken and elongate, but a lot of it truly is speaking therapist to therapist right now. It's really about a body awareness situation. It's myofascial release, but it's also body awareness. So getting them to become aware of their pelvic floor, for example. And very often when they're doing their pelvic floor awareness, that's when I ask them to drop in, bring in inquiries that will fire both right and left side of the brain, and then help them get really clear on setting an intention. Like the intention tomorrow's class, the theme kind of for a lot of my work this week is weariness. If you look at my post from yesterday, the state of weariness that everyone's going through. And so it's going to be looking at that weariness and being able to come from a place of energy conservation. We talk about that as OTs, right? But energy conservation and energy restoration. So tomorrow's really going to be about restoration. So we're going to we might roll through the hamstrings and the paraspinals and then get ourselves up into the upper rib cage. And then it has Pilates mat work in there to reinforce stability, flexibility. We're going to keep rolling and releasing, which again has a little bit of an emotional component. So I'm reminding them, remember, you might be emoting during this experience. That's okay. Here's some ideas to support you with that. Then we finish the whole class reviewing what we've done. We go back through, we talk about the intention with the hope that they'll take the intention through the rest of the week. And there's always usually a visual exercise in there too, because people are on screens way too much. So I'm usually giving them a visual exercise. That work-in class is chock full of so much stuff. I mean, there's a lot, but I make sure to put it out there in a way that it's not overwhelming. It just beautifully streamlines together. And the beautiful thing is that they all get a recording the next day. So there's no excuse not to have a home program. They've all got this huge library because they've all been doing it with me since May. A few people come in. One woman dropped out because she's having her baby in a matter of a week. And so she'll come back after the baby's born. But they all have this library now of home programs. And I'm like, you've got no excuse. You've got all these home programs and you have the tools to do it. So the work-in class is a great joy. I love Tuesday mornings for that. And just one more thing about that. So my whole tagline is for part of my work is why just work out when you can work in? Because working out, a lot of people step away from their brain, and working in is getting in tune with your body, increasing your body awareness. What are those emotions that are bubbling up? Let's look at them. How can we support them? How can we process them? Make sure that we are not letting them interfere with our brain body connection, so that we can feel whole and organized and be at our best self no matter what comes at us that day. So that's the work-in.
Okay, thank you. My next question is, how does Pilates and moving meditation help inner nourishment?
Oh, yeah. So you've definitely done your research on my website. So Pilates and what was the first part of the question? How does Pilates and
How
what?
does Pilates and moving meditation help with inner nourishment?
Yeah. I think that even pre-COVID, we were seeing a lot of malnourished people. And I don't mean of the fruits and veggies kind. I mean people who weren't able to nourish themselves. A lot of people come from upbringings where they weren't nourished or taught how to nourish themselves. And I think that a lot of us can find that movement helps us. And, a lot of people will say, I go for a run and I feel better, or I do this type of movement, I feel better. But when you move in ways that organizes your nervous system, you're going to be nourished on a deep, deep level. Now, my inner nourishment work actually has some of the nutritional components because I've done some extra studies in gut health. And so it has a lot of gut health, and we talk a lot about constipation. Nobody wants to talk about it, but as an OT with a pelvic floor specialty, I talk about constipation and all those types of things all the time. So I always say I'm working to help people elevate elimination so that it's a topic they can discuss and feel comfortable about and feel supported around. So inner nourishment has that as well, but inner nourishment is actually a coaching program I have that is usually a month long, and it coaches people through their gut health and the mind-body connection to that. There's a huge mind-body component to gut health. So the Pilates is there, but really inner nourishment is more about the moving meditation and then mindfully looking at what we put into our bodies as nourishment. and how our bodies process that. So a lot of GI. I should tell you, one of my trainings that I love most is visceral manipulation. Do you all know what that is? It's okay if you don't.
Yeah.
Okay, so visceral manipulation is it's all external, but I'm working with someone who's struggling with constipation. I'm doing manual work starting at the top of the tube of the GI system. I'm working with their esophagus, the cardiac sphincter of the stomach, and I'm doing releases all the way through transverse, ascending, descending colon, all externally, all very comfortably. And that visceral work will help their system work really well, whether they're dealing again with constipation or diarrhea. So the visceral work is a big part. I give people visceral exercises for their home program. I have a video that I could send to you if you were interested on why the squatty potty is actually really great. So I'm educating people about all that stuff because somebody has to, and people are super grateful when they learn that, hey, if I just change my pooping ergonomics, life can be so much better. So yeah, so that's a part of inner nourishment too.
Okay, and then my last question for you is, do you have any advice for occupational therapy students?
Oh, yes. I have a lot of advice. Again, learn very quickly how to set boundaries because we're empathic. We're super compassionate people that are drawn to this field. We want to help, right? And the burnout rate is really, really high. And I want to give you a resource on that in just a moment. So don't let me forget that. So learn how to set boundaries in really healthy ways. Make sure you have your self-care and stress reduction tools loaded up. Make sure they're all ready to go and constantly be seeking them. Don't be afraid to ask for help. Don't be afraid to work with a coach or another practitioner and get your own treatments. You know, when I went through integrative manual therapy school, I had to receive 120 hours of manual therapy before I could take my examination for integrative manual therapy. So it makes sense. Like you hear about people that go into the counseling or social work professions, they have to have so many hours of therapy before they can provide. I think all of us should have to go through so many hours of OT before we can be a provider. So we know what it's like to be on that other side. So self-care, boundary setting. The other thing is realize that when you graduate, when you finish your clinicals, when you pass your boards, that is just the beginning. Be willing to go out there and study and learn and learn and learn. Now, I'm not saying you have to be a nutball like me and take the level of continuing education that I've taken and all the courses that I've taken, because I mean, I don't even want to tell you how much money I've invested in that. But to me, I love it. It's my passion. You can be creative like with that. When I went to integrative manual therapy school, I was there one day and they said, hey, would you mind setting up snacks for the class? I'm like, no, I don't mind. They're like, okay, great. You're going to get a scholarship for setting up. I'm like, what? I'm setting up and cleaning up snacks. I would do that anyway, because I'm a community builder, right? But then I got tuition assistance. So if you want that Con Ed, but you're like, oh my gosh, I'm still trying to focus on paying off my student loans, be creative about how you get it, you know? So just be prepared that you've only scratched the surface. Start taking courses right away, whether you start taking a myofascial course or you decide that you want to take a course in feeding for pediatrics. I'm using that as an example. That's not an area I have knowledge in. But whatever course it is, just line yourself up, because when I was interviewing therapists to come work for me at my clinic, and let me tell you, everybody wanted to work at that clinic because it was an amazing setting. You were out of the factory, you had autonomy, but you had team support. You were allowed to be creative. You interfaced with other therapists in ways where you were all respected. I got tons of resumes, but very few made it past the front desk, because you'd see people that came in and they had been OTs for 10 years, 15 years, and they had 3 Con Ed courses. What? You should have at least 3 Con Ed courses a year that light you up. And now, because we can do so many virtual, the cost of traveling isn't as big of a part of it, but you got to get out there and find out what courses light you up and go after them. And one course will snowball into another and then another and another. So get on that ASAP. Like when I was finishing my last year and doing my clinicals, I started going to conferences and taking whatever I could. And I was taking things in hand therapy. And I quickly realized that I didn't want to be a CHT, but I had to explore those before I figured that out. I took a lot of different courses, and then I found my path and which direction I wanted to go. So yeah, I mean, I probably have a lot more suggestions too, but I don't want to overwhelm because I want it to feel like something you can do. Boundary setting, um, radical self-care. I was recently serving on a board at a conference, and I was on a board of experts, whatever that means, on radical self-care. And I'm going to tell you, as OTs, you need it so much, but especially now. And then find what lights you up and keeps your passion going. Because the day that you lose a sense of awe and wonder with the human body and its capacity to heal is the day you need to get out of the profession. Because that's and I want to speak to the burnout too, because burnout's real. It happens. I've been burned out before, and I just had to really drop in and use some of my tools and redirect the ship. But there's a wonderful OT, Erica, and I'm not going to pronounce her last name correctly, but Erica has a podcast, and it's called the Burnout to Lit Up podcast, BOLU, Burnout to Lit Up podcast. I was recently interviewed for it. I think she's doing great work. She sends out amazing emails with really rich details on tools, and she talks about burnout a lot. So I think as students entering the profession, that you should definitely follow that work, because it's a great resource. And find other resources like that. Or maybe you've got a niche interest and you decide to create a podcast. You know, I think more OTs need to have their voices heard. And that's probably my last piece, I would say, recommendation is you need to be ready to be the voice of the profession. We know that it's very often misunderstood, but I can't tell you how many of my clients and patients really understand what OT is. And they go out there and they tell people, oh, I've got my OT session. They're not mistaking it for PT. And they're out there understanding what OT is and able to explain why they need OT services. So be prepared to always be an advocate and a voice for your patients and for yourself.
Okay, now I think Megan has some questions for you.
Okay, great. I'm just going to have to pause for 1 second because I see my daughter coming.
Okay.
Hold on 1 second. Sorry. Is everything okay? Okay, go ahead and grab it.
I can't wear this sweater for ballet.
Okay, you need a different wrap sweater. All right.
Yeah.
Sorry, my ballerina needs a different sweater. Hold on 1 second.
Where is it?
Okay. Is it in your bag, honey? Maybe you don't need a sweater. You just warmed up in your other class, right?
No, I'm not warm enough.
Okay, watch for cars. Check,
I know.
double, triple check. All right, have a great class. Sorry.
You're all right.
Doing the mom juggle here. So I'm working in my office in my car. But you know what? I'm super grateful that I can do that, right? And my daughter's always in awe of it, and she understands what OT is, and she understands what it means to be a business owner, which is a whole nother level of work there. So yeah, go ahead. I'm ready for your next set of questions. These are great questions.
Well, good. My first question actually kind of ties into that of what is the most challenging part of starting Inspired Wellness?
So your question really is, what is the most challenging part about starting a business? And that was 20 years ago. So I think for me, it's so interesting because I started the business. I was moonlighting, seeing people in the evening for Pilates sessions, and then teaching seminars on the weekend. And I was just overflowing, and I decided, okay, I'm going to take the leap and open, a facility. And I just did it. And people were like, oh, you're so brave. I'm like, I really don't think I'm brave. I had no other choice. I had all these people looking for services and I didn't have a space. I was sick of driving around and trying to serve people in different settings. So I had a full book of sessions, or I had a full caseload when I opened. I think I was pretty naive. I mean, I was 27 years old, and I didn't really know what I was getting myself into. I think the biggest part of business ownership is financial. Really, I took on a lot. I bared a lot of responsibility. There were tons of times that I paid employees for months without paying myself. So I had to be willing to do that. So I think there's a real financial stress or challenge of that. I think the second tier of challenge was really staffing, Because again, I mentioned a moment ago, I had all those people that wanted to work there because it looked like a lot of fun and it was a great place, but they couldn't just walk in. They had to be trained in alternative modalities, which doesn't happen in one seminar or one Con Ed course. So these had to be people that were willing. And I actually, at that time, was a host site and I offered training. I taught seminars for people in rehab-based Pilates that was a year-long course of study. So I would get to see people in front of me and kind of pick the best of that group to consider to have as employees. But then once you hire people, you have to continually train them. And then you have to deal with when the employee moves out of state and you've spent all this time training them to be the type of therapist or practitioner that you need. And then boom, all that energy and time you've spent in training them is lost because they then move out of state or their life changes for whatever reason and they're no longer working. So I think that was a huge challenge and a huge stressor. And it's 24/7. You know, when I had that model, I mean, I'm still working on the weekends now, but it's different than when it was 24/7. And if I had an employee call in sick and I knew that all these patients or clients needed treatment, I was the one stepping in and doing the 12-hour days. So it definitely, it's definitely an endurance event and it's a lot of responsibility to take. And you have to be able to constantly upgrade or update with the times. You know, when I was first opening in 2001, a lot of people didn't have websites. And when I interviewed people to hire to build me a website, some of them wanted to charge $30,000. And I'm like, do I look like General Motors? No. So, you know, now I could do it on my own, you know, or a lot of businesses just start with Instagram and Facebook as their communication tool and later get a website. So I think you have to constantly be changing and staying with the times. And I think it's really important. And one of my saving graces was because when the recession hit in '07 was that I was very diversified as a practitioner and as our offerings. Like if we were just rehab-based Pilates, well, there's a lot of other well, not so much rehab-based Pilates. There's a lot of other Pilates and then some other rehab-based Pilates, but because we had all the other modalities, it allowed us to weather that recession that hit in '07 and come through pretty well. So I think that there's always those moving targets, always things that you're looking at. But business ownership is for someone that has a lot of energy and a lot of endurance.
On average, how many clients do you typically work with at a time?
You mean in one session, like in 1 hour, how many clients?
Yeah, or a day.
Okay. So I only see one person at a time. Pre-COVID, I would have a duet sometime going on where I'd see two people, but I have one client for 55 minutes. And this was when I left that initial setting of the traditional rehab clinic, I would have a couple patients and they would both be doing therapeutic X and set up doing them, but I couldn't watch them. I'm known as eagle eyes. I want to see that body. Not only do I want to see their form, but I want to see what happens to their breath. What are their diaphragms doing? Not just their respiratory diaphragm, but their lumbopelvic diaphragm, their thoracic junction, their cranial diaphragm, and the upper palate and their foot are all diaphragms. So I'm looking at all of that. So they call me eagle eyes. So I don't want to take my eyes off of them when they're moving. So I really prefer one-on-one. Occasionally I will work with two people at a time, but they have to be well matched. I do the group offering tomorrow, as you've already asked about. And so before COVID, I would see 8 treatments in a day. Now with this setting, I'm probably seeing 4 to 6 in person and 1 to 2 virtually. So that's what I'm doing right now. And you know, I'm not working at the level that I want to be, but it's what is working right now for my family. And there's a few clients I haven't let come back in because they're not taking precautions seriously. And I have a woman who's on a kidney transplant list. I can't risk anything for anyone. I take this very, you know, very seriously, this responsibility.
Yes. How are clients typically referred to you?
That's a great question. So tons of word of mouth, their friend, their sister, whomever tells them, but I have a handful of physicians that have referred to me for years. And now that I'm pretty full, I have people that I've trained that I refer to them. Like just today, someone was telling me that she she's having spinal surgery and she wants some of this holistic treatment. And I said, I'd love to see you, but I wouldn't be able to see you regularly. You need regular treatment. Here's a practitioner who I know, who I've trained. She's amazing. She's fully trained in Pilates as well as being an OT. So guess what? Go see her. So I have people that I've been involved in training, so I'll refer to them. I also, because I present at a lot of conferences, like last year I presented at the MIOTA, Michigan Occupational Therapy Association, then like 5 of those therapists wanted to come see me. I see a lot of OTs and PTs as my patients. I see a lot of yoga instructors and a lot of Pilates instructors. I think my work's kind of known in those communities. So it's really word of mouth. I do no advertising. I do some marketing and promotion for my online offerings because those can hold more people because it's a virtual offering. So I do share those in a different way.
Okay. What type of training have you done?
How much time you got? How do I answer this? What type of training?
Or what has been your favorite?
Okay, so I think my favorite is definitely the Brain Gym, GYM, like gymnasium, because it's so easy to use. You don't need extra tools. I love Pilates. I mean, I've been studying Pilates since 1999, and I've worked with all the apparatus, but then I do another level of training, or I do a dancer specific training with Pilates, or, another pelvic floor. I love my manual therapy training. That has an umbrella that we have myofascial, craniosacral, lymphatic drainage, nerve tissue work. I love that training, but honestly, one of my favorites is the visceral. I love the visceral because people overlook that. They miss that the organs, like when someone comes in with unabating back pain, I get people referred to me with back pain. They're seeing PTs as well, but they're coming to me for the holistic or something else. And just side note, a lot of the people that come to see me have tried every other therapy, or perhaps they had a failed surgery and they get sent to me. So that's another way people find me, is that they're like, oh, we heard about this woman who does this work, that when everybody's tried everything else, they go to her. But that unabating back pain might be that their kidneys need some mobilization, that they've got displaced kidneys, or perhaps their diaphragms are not working properly, and therefore they're doing tons of splinting and guarding in their thoracic spine. So when we open all those diaphragms with myofascial and craniosacral work, boom, we see a shift. So I think I love all my manual therapies. I love the Pilates work. I love the Brain Gym and reflex work. I can't really pick a favorite because they all become synergistic in my work. And I just laugh because my vitae is like 12 pages long with all the courses that I've taken, because if there's a course that interests me, I'll take it. And even if I take one thing from it, I'm grateful, and I've grown, I've learned.
Yeah. Down to our final question. Is there any historic significance with this form of complementary practice / meditation, and any cultural significance as well?
Good questions. Historical, and did you say cultural? Am I getting that
Yep.
right? Okay.
Mhm.
So let's unpack historical first. Historically, as an OT, I think when you really dig back to the roots of OT, we were the first holistic therapists. And I really want you as students to get out there and shout that from the rooftops, because holistic is, some may say it's a fad or it's a trend, but when you really dig down to OT, looking at the whole person, right? I remember in school looking at this wheel of like the social, emotional, the spiritual, the sexual. That's a whole person, right? So we as OTs study all of that. We as OTs look at mental health and physical health. And when I was in OT school, there wasn't a lot going on in mental health. We didn't have to do a mental health fieldwork level 2. We had the option with a fieldwork level 1. And let me tell you, I'm so grateful that I got to do a level 1 fieldwork in a mental health setting, because it left an impression on me. So I think that historically OTs were always the whole person holistic approach, but it's just never been put out there. And that's where I think I'd like to see AOTA do some more marketing and really push us out there. But I'm out there just being a loudmouth about it. Like, hey, just by nature as OTs, you're already holistic practitioners. You just got to sit with that a little bit more and go a little deeper.
Mm-hmm.
So historically, I think that we're well suited. We just need to run with it a little bit more and update training as you go on. Culturally, give me more, when you say culturally, what do you mean? Because there's a lot of different cultural discussions going on, a lot of needs in different cultures right now. Can you give me a little bit more?
Maybe more of like a cultural significance that has inspired wellness, or social value for it.
Yeah, I think all human beings deserve wellness. I think all people deserve wellness. I think across all socioeconomic cultures, or also socioeconomic groups and cultures. We need to be respectful of different cultures. For example, I serve some Orthodox Jewish women. When they come in, there cannot be any men in my setting. They have to wear long sleeves. They wear wigs when they come in for their treatments. And I have to be very respectful of that. So the first time I served someone from the Orthodox Jewish community, I took it upon myself to learn more so that I could be ready to serve and make sure my environment was welcoming and supportive. One of my best impressions in my level 2 field work was a gentleman, first generation man from Mexico. And he talked to me a lot about his culture and how they believed things would be, and in terms of healing. And for him, he talked about having to be very stoic as a man in his culture and having to be the breadwinner and be very stoic. So I think that we as OTs need to take it upon ourselves to learn about other cultures, so that as we're serving someone that comes in that maybe has different beliefs than we were raised with, that we're ready to have an open mind and open heart, and that our compassion extends to them even if they are different than what we're used to. So I would think there's a lot I could say about culture right now and making sure that we're there to serve people. There's a lot of intensity around culture right now in different marginalized populations. So I think that right now you're coming into the practice, into the field at a time when you really want to make sure your studies are hitting on that as well, and how you can welcome BIPOC people into your practice. How, if someone who is in a population that feels marginalized, how you can help them through purposeful occupation, because there's going to be a huge field for us to serve in that way as well. So I might have gotten off, but I just think I'm really inspired right now by what I see going on culturally. And I think that we want to make sure no one feels left out, because everybody's welcome at the table of occupational therapy.
Yes.
In my mind.
Well,
I mean,
thank you.
that's the way that I look at it. So yeah.
All right. Well, that was our last question.
Thank you
Can
so
I-
much for taking the time to meet with us. I think we've all learned a lot.
My
Yeah.
pleasure. Do you have a minute for me to ask you some questions?
Yeah.
I know you're busy, so I'll keep it short. So tell me, you're finishing your classwork, your coursework, and then are you going into your level 2s here pretty soon? Is that what's happening?
We're just in the undergrad program right now. So we won't start level 2s until the grad program. But I do believe they're having a little bit of trouble finding placements right now with COVID restrictions. Just from what I've heard through like our program page. But I think they're kind of getting that sorted out.
I was worried about that because it's a challenging time to have students come in when you're really trying to limit people in clinic settings. So, okay, so you're finishing your undergrad. Are you like in a 3-2 program? Like 3 years undergrad, 2 years grad school, and then you do your
Yes.
clinicals? Okay.
Yep.
3-2 program. Okay, so have you had some level 1 field work?
We started our level 1 in the spring, and then none of us were able
COVID.
to finish it.
Say no more, right? This is the tale of 2020. Okay. So how are you all as students dealing with the sidelining, if you will, and pivoting that you have to do as clinical students, not only with your level ones, but studying the clinical field, how are you all dealing with that? What do you need as students in the healthcare field right now?
For me personally, it was a lot harder last semester in the spring semester when everything was shifted so quickly.
Mhm.
But I feel this semester it's going a lot better. Since we are able to be hands-on still this semester and go to class, it's helped a lot.
Oh
Mhm.
yeah, that's great.
Yeah. I try to just take it day by day because it's really like I think it was last week, we got a message on Tuesday that we weren't supposed to come to class Wednesday because there was a COVID exposure. So it's really like you have to be able to adjust and like just like that.
Mhm.
And so that's really been challenging, especially like more for like an organization standpoint because I'm expecting to be in person, but now I got to be online.
Right, right. And that's, you have to deal with your technology being ready and everything.
Mhm.
Yeah.
And I feel like this semester is a little bit more challenging for me because everything is shoved into the first 14 weeks because the last 2 weeks like after Thanksgiving break, we're going back online to finish the semester. So I feel like it's kind of a little bit more fast paced than we're used to because they're trying to get everything done in class in person as much as we can before we go online.
Yeah, that's so challenging. I've been talking with a lot of people about people that are students, whether they're high school seniors, college seniors, grad students, PhD students, that I feel a lot of concern, worry, and sadness because I feel like you're not getting the typical experience. You're not getting the milestones, but I also feel like you're learning to pivot and become very resilient. And those
Mhm.
skills will serve you very, very well as practitioners. And I also feel like you're learning to deal with disappointment, which maybe you've had your fair share of disappointment already in life, but sometimes we don't deal with that until we're later in life. And so getting it now is building your resiliency muscle. So as crazy as that
Mhm.
sounds and as much of a bummer as it sounds, I think you're going to be very resilient people and you need that as OTs, you know?
Mhm.
So yeah. Well, keep me posted on your class. I'm very curious how this course is going. I've actually taught a course at the University of Indianapolis, my alma mater, on for people going back to get their master's or their doctorate and PhD, all about alternative therapies. So I am very excited to see that it's required for your coursework. I feel it should be required at all OT schools. Feel free to use me as a reference in terms of like if you need information, I could be a resource.
Mhm.
I love knowing what's going on with students and seeing you go out in the field and seeing you all succeed because I know you will. And I just wish you all the best. It's a great field. It's got some challenges, but I think if you're creative and you're perseverant, you will find that you can stay connected to the work for the right reasons. And feel free
Mhm.
on my website, the free gift to essential workforce. I consider you essential workforce because you are OTs in that you'll be on that field and you're being trained to become essential workforce. So feel free to tap into that. Um, think of all of your fellow colleagues. One of my best friends from OT school got COVID. She's an ICU OT, right there in the trenches. She got it from a patient. She's about 10 weeks post. She's still struggling. So just stay safe out there. I don't say that to be
Mhm.
alarmist, but I'm just saying everybody talks about nurses and physicians and they are amazing, huge gratitude. But OTs and PTs and other allied health professionals are right there being exposed as well. So
Mhm.
just stay safe and keep me posted. I'd love to hear how things are going for you. Of
Yes, of
Thank you
course.
so
Thank you.
much.
Thank you.
course, my pleasure. Take care.
Thank
Have a
you.
great
Bye.
rest of your night.
You too. Thanks. Bye-bye.
Bye.
Bye.
Do I just hit stop recording?
I think so.